Did you know that you can take charge of your hearing health right in the center of Nexton? I'm here with Jennifer Bonner, an audiologist here at HearingLife Nexton. Jennifer, thank you so much for having us.
Thank you.
I'm so glad that we're here. You know, we were talking before too, your hearing health is something that's so important to your overall health. Can you talk about why it's so important to, go and get checked and make sure that you're taking charge?
Absolutely, because it's not only a matter of, just being able to hear better. Hearing health, hearing loss really can affect so many other factors of your life. There's consequences to not treating your hearing loss. So in terms of early onset, memory issues, diabetes, cardiovascular disease, risk of falling. Mm-hmm. So it's really important that we really address these issues early on so that we can help these patients hear better and also feel better.
Mm-hmm. What all do you offer here at HearingLife Nexton?
So one of the biggest things that we do is campaign for better hearing. Mm-hmm. And it's a nationwide, thing that we do. And we provide hearing devices for those that may not be able to afford hearing devices. So it's a nationwide campaign that we do, and we are able to provide hearing devices at no cost for some hearing patients that are in need. Mm-hmm. And we fit them with the hearing devices, we program the hearing devices, we do all of the follow-up and everything else to get them hearing better and be more part of their community again.
Oh, that's amazing. I'm sure that's so life-changing to so many people.
It is. Yeah.
What have you seen the impact of, taking charge again? Like, if you need hearing aids, what have you seen that impact be, on your overall life?
It's been life-changing because it's not only like a physiological thing. We know that there are certain causes for hearing loss, but it's also psychological. Mm-hmm. So there are so many patients that we see that may start withdrawing from certain situations that they used to be comfortable going into. Mm-hmm. Group settings, background noise, restaurant type things. So what we're able to do is provide them with kind of that more of a connection. So they're able to hear better, not only through the hearing devices, but also be able to be more connected to their community, to their loved ones, be able to hear more clearly on the telephone. Mm-hmm. And extra devices and things like that.
Do you think there are a lot of misconceptions out there when it comes to this technology? I'm sure it's improved so much throughout the years.
Everything is digital, so everything's programmed on a computer. So they're all programmed based on the individual patient's needs in terms of how well they need to hear at different frequencies, which we do the testing and all of that to accommodate for. They're much smaller, so they're much more discreet. They are rechargeable, so you no longer have to change a small battery every 5 to 7 days. You can put them in a charger for as little as 3 hours a night and then have a full day worth of charging off of that. In addition to that, there is Bluetooth capability. So if they want to receive a phone call through their hearing devices, a grandmother wants to see a video from their grandchild, they're able to stream that right to their hearing devices. So the technology has come a long way, long way.
When you call HearingLife, you can get a free hearing test, right?
You can, yes. It's a complimentary hearing test, so we do not charge for the hearing test, even if a patient does have some, commercial insurance or Medicare. We do not charge at all for the complimentary hearing test.
And how often should we be going to get one of these tests? I know a lot of us probably haven't had one in years.
Yeah, so once a year. It used to be, we used to encourage patients to come right around the age of 60. Now it's honestly getting earlier. So it's right around the age of 50, because as we all know, there's so much more noise in our environment nowadays. So there's more traffic on the road, there's more background noise in the restaurants we used to enjoy going to, and now the acoustics aren't the same that they used to be. So we encourage about once a year, right around the age of 50. We do a complimentary hearing test. We always encourage patient to bring somebody else with them, because it's nice to have a second set of ears on things, because sometimes the patients don't realize exactly how much they've been missing. But we incorporate that what we call third party, whether it's a spouse, loved one, neighbor, somebody else to kind of come in and really help with kind of the evaluation process. And we do a demonstration as well. So not only after we do the hearing test, we will actually program a pair of hearing devices for that patient, and then they're able to listen to them. I take them outside, we walk outside to kind of give a real life demonstration of what they may sound like with that significant other, so that they can really appreciate what it sounds like to hear better.
How can people set up their free hearing test?
So you can call the number on the screen, and we are more than happy to set you up with a complimentary hearing test. We'll do the demonstration of the hearing devices, but yeah, we welcome anybody to call and we'll get you set up.
Awesome. Jennifer, thank you so much.
Thank you, I appreciate it.
Of course.